we're going to analyze. We're also going to analyze COVID-19 communication successes and failures through the lenses of history as well as ethical principles. And I just wanted to start by offering you a chance to gaze at this wonderful painting from the 1950s by the artist Robert Thom, which shows the great Greek physician examining a child. And I want to use this image to remind everybody that when we as health professionals are communicating, there is a lot of nonverbal communication that's going on. Look at what's happening in this picture. Hippocrates has got his right hand over the liver of this child who is looking rather ill. He's hunched over, he's leaned forward in attention, and he is showing by his body language that he is in the moment and he is respectful. And in addition, look at his gaze. His gaze seems to be turned towards the mother, who was also meeting the gaze of Hippocrates. And he's communicating to her that he is attentive and he is concerned. And the mother herself is communicating with her facial expression that she's anxious and concerned and very caring of her son, whose hands she's grasping with both of hers. And the child's face shows some distress. So there's enormous amount of communication that we humans can send out and also receive if we pay attention. Notice that nobody in this painting in the 1950s is wearing a mask. And imagine how much of this communication would have been interrupted, truncated, and made smaller and less meaningful if people had been covered with PPE, face shields, and masks. That reminds us of the challenges that we all face as health communicators in the middle of an infectious disease pandemic. All right, so here we are. This is modern day, and you notice that these are actually healthcare providers. They're all masked. This is you and me. All right, and they're standing in front of a portrait of what? The Mona Lisa. And what is the Mona Lisa famous for? The Mona Lisa is famous for her enigmatic smile. If you put a mask on the Mona Lisa wouldn't even be the Mona Lisa anymore. So I'm just making the same point about the challenges that we're facing. And when we don't have access to our body language, we have to be much more careful with our words and our tone, right? So let's look at a timeline of what's actually happened. And I'm going to take it through really quickly because we don't have excesses of time, but it's amazing when you put these facts of our history with the pandemic side by side and reflect on what happened. So here, go back in time to February 2020, just before we had our big shutdown. And here's the Surgeon General of the United States at that time, Jerome Adams, who was sending out messages on Twitter saying, stop buying masks. Seriously, people. So this is the tone of a health professional. Seriously, people, stop buying masks. They're not effective in preventing the general public from catching coronavirus, but if healthcare providers can't get them to care for sick patients, it puts them and our communities at risk. And that's kind of where we were at back then, is we didn't want the public buying up all the masks and preventing health professionals from having access to them in healthcare settings. But maybe there would have been a way to communicate that without undermining the message of masking and being safety. So it's partly jumping the gun and saying things that we didn't really have all the information about. That made it so much harder to go back and undo that. Undoing the message when somebody like the Surgeon General has said masks don't help is pretty tough. Here is Fauci in March of 2020 saying, there is no reason to be walking around with a mask. If you don't believe that Fauci actually said that in March 2020, you can go and check out 60 Minutes episode from that date. April 3rd, 2020. Now, the CDC recommends that Americans consider wearing a cloth face covering. So now the message is, yes, you should mask, but hey, don't get the surgical mask because we need them for the healthcare providers. But maybe, Lord willing, the cloth mask will protect you. And so this is actually a picture from San Antonio, one of the nursing homes that I had the privilege of visiting, where people were showing me their own handmade masks that they were making for everybody. July 14th, here's CDC director. At that time, it was Dr. Robert Redfield. Look what he said. He said, we are not defenseless against COVID-19. Cloth face coverings are one of the most powerful weapons we have to slow and stop the spread of the virus, particularly when used universally within a community setting. All Americans have a responsibility to protect themselves, their families, and their communities. And he said, I might even go so far as to say that this face mask is more likely to protect me than a vaccine. Wow. Immediately thereafter, the president contradicted what the CDC director said. So who knows what to believe when the leaders are coming forward with contradictory information? Mr. Trump said that Dr. Redfield had made a mistake in suggesting that vaccines could be more, masks might be more useful than a vaccine. Now, fast forward to January 2021, there's been an election. President Biden used his executive authority to impose mask requirements, which by itself was something that elicited a firestorm and a bit of backlash, because people, especially in our culture, don't necessarily like to be told what to do, and certainly not by a federal mandate. But he imposed mask requirements on federal property, interstate travel, in airports, intercity buses and trains, urging all Americans to mask up for just 100 days, just 100 days. In March, the CDC, at this point we've gotten vaccinated, right? We started seeing vaccine in December 2020. Healthcare providers were getting their second dose of vaccine in January 2021. And so in March, the CDC now says fully vaccinated groups can start to gather in small groups. We're not in shutdown anymore, but there has to be, and we don't even have to worry about masks or social distancing if we're fully vaccinated. So we all started planning a few social get-togethers with relief, and some states began lifting their mask mandates. Here in Texas, our governor lifted mask mandates and capacity limits on all businesses as of March 10th, so that people could have the freedom to determine their own destiny. Shortly thereafter, the CDC went into greater detail about relaxing masking for outdoor gatherings. And I don't know if you remember, but we had very complicated signage with like red, green, and yellow codes for different types of activities, masked versus unmasked, depending on whether you were vaccinated or unvaccinated. And you could look up the activity and decide if you were masked or unmasked, or you're going to be indoors or outdoors, whether that was a red, green, or yellow safety choice. That was pretty complicated, and it might have been a lot simpler just to tell people some big picture concepts. If you're fully vaccinated, you don't need to wear a mask outdoors. If you're non-vaccinated, you might also be able to go out without masks in small gatherings. Big picture was outdoors is safer than indoors, and masked is safer than unmasked. And those concepts would have probably been easier for people to understand and retain. In May 2021, the CDC also said that masks were still required at doctors' offices, so in our clinical care areas, and gave a whole long list that you had to kind of learn: a plane, a bus, a train, a transportation hub, prisons, jails, long, complicated list. And then they said vaccinated people should defer to existing state, local, or tribal laws. Yes, they really said tribal laws, and follow rules and regulations for businesses and workplaces. And this, of course, I'm being funny now, was it any wonder that people organized themselves into tribes? And we had the tribe that was pro-mask and the tribe that was anti-mask. And that's really what we saw happening in our country, and we still see residues of this today. May 16th, 2020, Dr. Rochelle Walensky is now the CDC director. She says right now the data, the science shows us that it's safe for vaccinated people to take off their masks. I, as the CDC director, promised the American people I would convey that science to you as we know it. We are asking people to be honest with themselves. If they're not vaccinated and they are not wearing a mask, they are safe. If they are not vaccinated and they are not wearing a mask, they are not safe. So she really said that. Take note of the date, on May 16th, 2020. Right as she said that, what was happening was we had the rise. Look at that, May 22, we started to see an uptick in the Delta variant prevalence in the United States. And the Delta variant was much more infectious and potentially more deadly, but certainly much more infectious than the original variant. And we saw this dramatic rise, and quickly Delta overtook the earlier versions of the COVID-19 virus. So that happened right as Rochelle Walensky gave out this message about taking masks off. So Delta was on the rise, masks came off, and what happened? Of course, we saw cases rise in the United States. So the communication about health has direct consequences in the epidemiology of disease and the lives of individual people. It took until July 28th for Fauci to come on and say, well, the situation has clearly changed since Rochelle Walensky said we could take our masks off on May 20th. And he now says that vaccinated people really still have to wear masks indoors. And this was new CDC guidance. But, and I'm not trying to diminish the stature of Dr. Fauci in making this picture of him with his eyes closed. It was just the snapshot that I captured, but it also illustrates the challenge that Dr. Fauci and all the rest of us are facing with trying to help people understand that we're not crazy. We're not just manipulative maniacs with these changing recommendations. The data change, and so the recommendation changes. So at that time, the new data showed that vaccinated people could actually spread infections caused by Delta. So the health officials now called for teachers, staffers, and students in schools to wear masks regardless of their vaccine status. And in August 2021, we saw deaths rising in the state of Texas. So that third wave there. And we saw cases begin to rise in Bexar County. So once again, when we communicate about behaviors, what we say will have direct impact on what people do and the outcomes. And with all that going on, you can appreciate and relate to this cartoon. I certainly can, where here's one person's masked, one's unmasked, and they're going to a restaurant. And the unmasked guy saying, wear a mask, don't wear a mask. Booster shot, no booster shot, I'm getting the twisties. And he was, of course, referring to the Olympic gymnastics athlete who right around that time had withdrawn from Olympic competition because of her anxiety-driven and inability to keep track of her body in the air when she was doing gymnastics leaps. But that was, articulating what many of us were feeling. And there were more communication fails. So that was, I went through a timeline of the back and forth about masking and then vaccination boosting. And you could do the same timeline for PPE messaging, testing messaging, quarantine versus isolation confusion, and vaccination and people's anxieties and concerns about vaccine side effects. And remember, the Johnson & Johnson vaccine got paused for a while, which also undermined people's faith and belief in the vaccine safety. And our public leaders were often problematic, as in here when the president suggested injecting disinfectant, and there were some people who actually had adverse outcomes from following through in some way on that suggestion. But it wasn't just the public leaders, okay? It was also individual doctors. And individual doctors, for whatever reason, jumped on the bandwagon of hydroxychloroquine. And it's clear that physicians are susceptible to public messaging in the media, by media people and by politicians. And what you see here in orange is the number of never prescribers of hydroxychloroquine who then started prescribing. And they prescribed not just randomly across the board, but the prescriptions rise and fall depending on what the FDA is saying and who politicians making tweets. But there are also people like this physician here, Dr. Peter McCullough, who was a Texan, who was actively testifying in front of the Senate Committee on Health and Human Services on behalf of using a drug, hydroxychloroquine, which lacked evidence. And this physician and many others like him have played a significant role in confusing the public and undermining public trust in our profession, which results in failure to adopt health protective behaviors and lost lives. So I've told you some failures, and a lot of the failures were driven by the fact that things change rapidly and we're faced with something new. So whose fault really is it? We're trying to do our best. But historically, we can learn something if we look backwards. And there were some vaccine communication successes in our history. And I'd like to give you the example of polio vaccine. So in April of 1955, a polio vaccine trial result was announced, and polio vaccine works. It protects people from this terrible, frightening paralytic illness. And there was literally jubilation in the streets across the United States and in the world. And within 2 weeks of rolling out the polio vaccine, however, 25 children got paralyzed because they had received improperly prepared polio vaccine. I mean, what a catastrophe. What if we had had 25 kids get paralyzed within 2 weeks of the COVID vaccine? Imagine how that would have put a chill on our vaccination efforts. We didn't even have that kind of thing. We did not have a whole lot of adverse events. When we did, we all heard about them, and they were in a very, very small fraction of the population. But what happened was the Cutter vaccine was withdrawn very promptly, and somehow, despite the tragedy and the recall, the vaccination was able to continue successfully. And it wasn't just 25 kids who got paralyzed. There were actually deaths, and there were hundreds of people who were affected by this by the time they actually wrapped it up and pulled it. So what was the difference? What's the difference between what was happening in the 50s when people would still get vaccinated in spite of this kind of thing, and 2021, when it's not, the side effects are really not even so terrible, but people don't have faith, they don't have confidence. I think it has to do with how healthcare professionals were viewed in the decade prior to the polio vaccine. So these are just some ads. And I want you to take note of the fact that physicians were so highly regarded in that day that they could actually credibly go on TV or be in a poster advertising cigarettes, which we now know to be very harmful for health. And so these are 2 cigarette ads where doctors are promoting smoking in the 1940s, and they chose doctors because doctors were so highly regarded that if somebody said smoke and they were a doctor, you were going to smoke. And if you look at the small print that's in these ads, you will see how people ascribe these virtues to physicians as being people who are available 24/7. They're always polite and respectful. They're always there to put the patient first and disregard, their own needs. People held physicians in very high esteem. There was a high level of trust, maybe not for the good, right? Because here they're promoting a negative message, but there was a high level of trust in the healthcare professions at that time. And that's something that's really changed. But we also saw in this pandemic scapegoating. We started blaming people from China. You heard about the China virus. And then some people started blaming the migrants. And we had migrants pouring across the border, the Texas-Mexico border, and it was said all the migrants are bringing the COVID. That is not new in human history. If we look at the Black Death or the plague in the Middle Ages, here's a painting from the medieval times showing the citizens of Tournai, Belgium, burying the dead during the plague of 1347. Nobody had any idea about germ theory of disease. And so what they said was, we think the Jews have poisoned the wells, and that's why people are dying. And consequently, let's kill the Jews. So the Jews were actually massacred for poisoning the wells. And medieval communities were so afraid of the plague that the word alone was enough to frighten them. They avoided mentioning it as long as possible, and they even avoided taking the necessary precautions at the risk of aggravating the effects of the epidemic. How about that? They couldn't even say the word. We saw this with COVID. We saw people coming into the hospital with COVID and getting intubated and still in denial that COVID was a thing. They didn't want to accept the reality of it. So fear is something that characterizes pandemics. And when human beings are terrified, they try to find a scapegoat. They look for somebody or some group of people to blame. This is something we need to understand about ourselves, because you know what's happened in COVID? The healthcare professions and professionals, which previously were held in such high esteem, have kind of become the scapegoat. And if you don't really believe that, go read some of the experience of our colleague, Dr. Peter Hotez from Baylor in Houston. In this Scientific American article, he states that anti-science has emerged as a dominant and highly lethal force. one that threatens global security as much as terrorism and nuclear proliferation, but we must mount a new counteroffensive, okay? This is a key part of what I'm trying to communicate in the Ethics of Health Communications ECHO presentation. What do we need to do? We need to build new infrastructure that combats anti-science. We need to rebuild trust, just as we have when we've dealt with other serious threats. So I assert that during the COVID-19 plague, science and scientists and health professionals themselves have actually been scapegoated. And one of the things that seems to characterize scapegoats, if you remember the story about the Jews in the Middle Ages, it's always the outsider. It's somebody who's not really an insider, but rather an outsider, somebody of low influence who gets scapegoated. So we need to look at ourselves. Why are we outsiders? Why are we outsiders? Are we the right person to be giving a certain message? Or do we, well-meaning health professionals, need to engage with other people who are not outsiders in order for the message to be propagated? I think this is a really important, profound question for all of us going forward. So what are the consequences of health communication failures? Lives are lost, right? Lives are lost, and when we do things poorly, we generate further mistrusts of science itself, scientists, and the healing professionals. So what are the ethical principles for health communications that we can find in the health communications literature, and what are the ethical implications, not just for physicians, but for anybody who's clinically active with patients? And so if you think about and read about principles of health ethics in general, you'll recognize a lot of these principles that are highlighted when scholars delve into what are the ethics of health communications. You have to adhere to the same core principles of beneficence, always doing what's best for the patient, non-maleficence, first do no harm, respect for personal autonomy. If you don't give somebody accurate information, they can't make choices for themselves. So failure to provide truthful and accurate information is a violation of the principle of personal autonomy and fails to show respect for a person's right to choose. And then finally, justice, which says that groups of people that are similar in status need to be treated equally, which brings us to questions of equity and is everybody being treated fairly? So we have to highlight respect, freedom from intimidation, and the use of understandable language. And these are the core ideas that underlie the communication principles that we're trying to pass along with our health confianza provider, ECHO. Public health information must be clear and complete, but not necessarily exhaustive. Why do I highlight that one? Remember the CDC poster with the 55 different scenarios, whether you're vaccinated or unvaccinated, masked or unmasked, whether you're indoors or outdoors, at a crowded place or a less crowded place. That was complicated. And when things are too complicated and we bombard people with information, they don't get the takeaway message and they don't wind up believing or absorbing any of it. So we have to be much more savvy about not bombarding people. We can't overload the public. We also have to respect people's culture. If we're disrespectful of culture, then we have no traction, no trust, and no credibility. Too much information impairs decision-making. I can't emphasize this enough. So healthcare communication, which is ethical, is that which is truthful, respectful, clear, compassionate, supports and advances the patient's goals of care, and responds to the community's identified need, like ending the pandemic or taking into account what the community says they're actually worried about. Now, this photograph I love. This photograph is actually taken in one of our own clinical settings. This is a student as part of the group Frontera de Salud, which does healthcare screenings and health education in underserved communities. And I just think there's so much to be learned by observation of this communication scenario. The patient is actually somewhat anxious because they're getting some information that's concerning to them. And the physician there, who's actually a student, is very respectful and with her body language is communicating an appropriate level of concern, but actually has her hand on her heart, communicating her sincerity, which is so important for building trust. Inattention to communication, on the other hand, can result in confusion, conflict, failure to address suffering, and error and harm. And we'll have an example of error, hopefully not harm, soon. And ethical communication can also be challenging. So what are some helpful strategies and lessons we can take forward? We need to think about health literacy, which is what we're all about with this Health Confianza Echo. We need to understand and delve into principles of health communication, not only from the old literature, but from new and evolving approaches, so that we can engage in evidence-based and generate some evidence-based approaches for health and behavior communication change. I emphasize again and again our key role in restoring trust. If nobody trusts us, they're not going to listen. If they don't listen, lives will be lost. Physicians and personal narratives can sometimes improve the perceived effectiveness of the public health recommendations on social media. It turns out that healthcare providers, when they share, well, I got the vaccine and my mom got the vaccine and we're all okay, when there's a relationship of trust, these kinds of testimonials can actually be very, very powerful. So we all learned this basic definition of health literacy when we first started our Health Confianza Echo, but I like to remind everyone what we mean when we talk about health literacy. It's the degree to which individuals have the capacity to obtain, process, so we don't want people to get too much information, too complicated, too fast, and understand the basic information and services that are needed to make appropriate health decisions. And remember that 9 out of 10 adults have difficulty using everyday health information. So when we ask you guys to submit your cases to us, to Health Confianza, we want you to give us an indicator of what kind of health literacy level your patient that you're presenting has, because that will affect how we approach our recommendations for that patient. And you'll see that if we can look at our form in a little while. Here's an example of how we simplify overwhelming amounts of data and information into takeaway messages that everybody can grasp. And this is our Health Confianza team, Jason Rosenfeld, Mia Vento, at a food bank drive-through at one of our local churches on the south side, where we had the 5 mensajes clave sobre las vacunas COVID-19. We had them in Spanish and English. They are over there on the right-hand side. Vaccines are safe. Vaccines are free. Believe it or not, people still need to have that. Vaccines have side effects, we're not going to lie. And those are normal signs that your body's building protection. And you still need to wear a mask and practice social distancing after getting vaccinated when community prevalence levels are high, wherever you live. So these 6 health communication skills are so vital in health literacy and in promoting health behaviors. And I have now centered these within the ethical imperatives that we have as health providers to be effective health communicators. And I remind you that these are setting the tone, active listening. Remember setting the tone. Remember Hippocrates and his body language with the child at the beginning of my talk. Active listening means you actually ask follow-up questions, or you periodically summarize what you've heard the patient say about their fear, their anxiety, or what they understood. Using plain language, no medical jargon, please. Acknowledging different perspectives. You're never going to get people to get off the idea of the chip in the vaccine if you just shut them down and say that's fake. You have to say, well, I think I've heard that from a lot of people, and I can understand it's really out there in the media. Let me tell you what I do know about why I don't think that there's vaccines. That's the different than shutting somebody down and saying, you're false, here's what's true. That doesn't bridge respectfully from myth to the fact you want people to remember. And then finally, using the teach back method to check for understanding. We talked a lot about that last time, how important it is to use teach back. And I think that emphasizing setting the tone, which is what I was trying to highlight with the painting that I started with, is something that I want people to focus on a little bit today. Start with something simple, find common ground. Get buy-in from the patient. Don't be presumptive when you're talking about vaccines. Say, is it okay if we talk about the COVID vaccine? Sometimes we're in such a hurry that we rush through our message and it doesn't really land. If that's the case, we do have to acknowledge and apologize that we don't have a lot of time. Ask open-ended questions. Ask for permission. Can I tell you a little bit more about this? And then normalize and encourage questions as part of a shame-free environment. And I'm going to skip over that one, but my most important message today is that we have an ethical imperative to restore trust between the public and between the health professions, whether we're a doctor, a nurse, an LVN, an MA, a community health care worker, a PharmD, a pharmacist. We need to restore the trust. And this is going to require that, gosh, go back to early education. There has to be good teaching in grade school about what the scientific method is. We need to explain to our public that as knowledge increases, guidelines will change. So we're not nuts for switching our recs. We're switching our recommendations because the data has changed. So teach people about responding to data rather than dates. When can we take off our masks? It's not about the date, it's about the data. We have to demonstrate authenticity and sincerity. Remember the photograph of my student with her hand on her heart as she's speaking sincerely to a patient. And this will help, if we do that consistently, help people see that guidance changes are not meant to manipulate, but rather to protect. It's important that we not be political when we're guiding people to make decisions about their health. And we need to teach people how to evaluate information and evidence to determine if something is true. And you're going to have a session on that. I think it's going to be session 6 with Dr. Jason Rosenfeld, who will help us unpack how we teach patients and how we teach the public to critically evaluate whether information that they're looking at on the internet or on social media is actually true and accurate or not. So in summary, I've shown you that there's been a history of spectacular COVID-19 communication failures. These failures have to be examined within the context of human history. Plagues happen, people are fearful, scapegoating happens. Culture, archetypes like the archetype of the scapegoat, characterize our response to both threat and uncertainty. If we understand one another, understand humanity, it helps us be less judgmental and angry about what we see happening that's so challenging. There's always going to be scapegoats. And perhaps healthcare providers, we, science, have become the COVID scapegoats. Now we have an ethical imperative to rescue that from the current situation in order to rebuild the trust. Ethical principles apply to health communications in a crisis, and sometimes less is more when we must communicate complex information. Health literacy is a tool and a moral imperative that will help us out of this pandemic and the next one, and any other public health crisis that we may be facing. And clinicians of all stripes need to work to reestablish the trust of the public and to know that our voices actually matter. So with that, I'm going to end my presentation on ethics of COVID-19 health communications and ask you if you have any questions.